Welcome, everybody. Today is the first day of the 2024 Workgroup meeting, and we have an important topic that we need to talk about today, which is next week's Phenotype February program. This workgroup, as you know, is responsible for that, and we've done it before. There's a proposal that's on the table about how to do the Phenotype February this year, and it's been led by a small group of people. Aza Shaibi, Anna, Asiye, Jamie, and me. And we have the document, so we can go through the document today. So I'm waiting on some of those individuals. I got Jamie on the call, but I don't see Aza, Asiye, Anna on the call. So we'll give them a few minutes to join. And the second agenda topic that we want to talk about is the OKRs. We'll report out on our OKRs end of February, so we have some time, but we do need to align on what our OKRs are for the year. There's a few things that are given. Phenotype February is a given. OHDSI Phenotype Library is a given, but what else do we want to do as part of 2024? And I see Anna's on the call. Anybody else, anything else they want to talk about before we go into this protocol or this proposal? Did everybody have a good New Year's?
We should stop asking this question.
I was gonna say we're
it's 25th, right, or 26th.
You can press it through
the
year already. Okay.
I think the question now is how much we.
Anna, welcome. Go ahead, Jamie. Sorry.
No, nothing. Just making a dumb joke. Carry on.
Okay.
Hey guys, so can you hear me? The internet in J&J campus is very, very bad the last 2 days.
Yeah, we can hear you, Aza.
Okay, good.
So I have the Aza, I don't know if you can see the screen, but I have the document that you created along with the comments from others. I'm sharing that as a screen, and also I've sent out an email to everybody talking about what we want to achieve today. So one thing that we want to talk about is the proposal that has been put forward for the Phenotype February of this year. Go through it, go through the document, agree, make any changes if needed, and then start rolling it out. We need to, once we agree, then we need to send a communication out today. We need to send a communication to Craig Saxon so that he sets the agenda for next Tuesday's call. And I think next Tuesday, that is the last meeting of January, will be when we will give an overview to the community about Phenotype February. We need to do a forum post. We need to send some promotion materials. We need to create, I think, a questionnaire to elicit some ideas from the community. So do you want to go through this document, Aza, and or Anna, or if, is Asiye on the call? I don't think I've seen her yet. Or Jamie, or should I go through the document?
Go for it.
Okay.
I can just chime in here and there.
Okay.
Yeah, if you want me to go through it, I can. Otherwise, feel free to go. Yeah, absolutely. Whatever you prefer.
No, we can. Can you is it not working? Can you hear me or?
I can hear you fine.
Okay, so do Gautam want to also leave some time for the OKR, because we do need to send the OKR for Craig. I think, was it end of this week? Yeah, so or Monday. So you also need to go through the OKR. Maybe leave some time for that at the end.
Yep, but second agenda item, yes.
Okay. Okay. So let's see, how many people do we have on the call? 17. Okay. So so it is January 26th, and so that means we are very close to the first thing is we have to decide is we do want to do Phenotype February or not. But I think that given the feedback we got at the end of last year of like what were the most activities that were interesting for the community, when Patrick opened that call at the end of the year, last year, we got a lot of votes for Phenotype February. Also, there were a lot of positive feedback during the symposium. So our sense as a group that there is interest in continuing this activity to give the community some focus time to make some progress on phenotyping. And that can take different shapes. So we have a group of people who is interested to continue this activity for this year and spend some time on it. And of course, it's part of the goals for the phenotype group in general. So just a reminder, everybody, of what is the point. So the point, it's really the idea of Phenotype February could be anything. It's just giving time and focus for a group of people to work on something related to Phenotype February, and also to share and invite everybody in the community to either learn from these things or contribute to these things or have a discussion on these things. So it's really just a commitment to discuss, make some progress, talk about phenotyping in general. Okay, so for who, I assume everybody is familiar with what we did last year and the year before. And the idea this year is to do also something, could be completely different than last year, and we're really open, nothing is set in stone, but this is what we have, like a straw man proposal for what we could do this year. I'm not going to go into the background, but really the idea is do a collaborative study. And I'm not going to call it network study, because network study usually entails, by definition, using data sources from across the network. But here, that's not necessarily the case. We're just thinking of performing a study in a collaborative manner, meaning that there will be multiple people contributing, and then we will divide the tasks across the people who's interested, and then get pieces together, and at the end write something that we could summarize our learning, which can lead to a publication or an abstract or some sort. The study that we are thinking to conduct is a investigation that aims to basically understand the current status of practices of phenotyping in observational studies. And the way, and by understanding the current status, we want to understand, many people understand what's kind of the best practices or what regulatory say in terms of phenotyping and what the science say, but what exactly is the current practices is something that we know that there's a gap, but we don't necessarily fully understand how the gap is. And here's the idea is to understand what do people do in our field in phenotyping? How do they develop phenotypes? How they assess or evaluate these phenotypes? And then how consistent or inconsistent this across the field. So to transform that into a concrete experiment, we thought of the following. We can decide on 10 clinical ideas, and those could be conditions or procedures that we will focus on the phenotypes for those. And that's something that the community could agree upon. We take those 5 ideas or 10 ideas, and that 5 to 10, we're just saying 5 may be the minimum and 10 is the maximum, depending on how many people we have. But we take, say, 5 ideas, and then we do a literature review to summarize or to accumulate all the phenotypes that have been developed or used in actual observational studies for those ideas. So let's say we take something like uveitis. So we will have a literature review, systematic literature review that will bring all the studies that have either developed phenotype for uveitis or used uveitis as a study population or an outcome, and so use some phenotype, and they use something. So we summarize all the studies for 5 different ideas, and we put them in a systematic literature review template that we already have, because as you all know, part of phenotyping is kind of do a literature review to understand what others did. So we implement this systematically, we abstract the data, and so we will have what were the phenotypes used for these conditions, what were the, and that includes the logic, the codes, anything that has to do with the phenotype, what were the method at which people validated or evaluated or reported basically justification of how they think that phenotype perform. And then also, how did they report on that? How did they communicate that information? How did they describe these phenotypes? And that varies. So in some papers, you will have a full code that people can access to re-implement the phenotype, and that's the very rare best case scenario. But in many cases, the paper just say something like, we define uveitis as a occurrence of this code, and that's it. Sometimes they provide a list of the codes they used. Sometimes they specify the logic very clearly, and sometimes they do something very vague in terms of the logic, something like you have to have 2 codes with a treatment, and then never explain when do the treatment can occur or should occur, and so forth. So we know from our experience that how people report on the definition itself varies, and that's another dimension of the variation that we want to report on. So we do a systematic review, we abstract the information, what is the phenotypes, how did they validate it, the method they validated, what were those validation metric they reported, and then how did they report that information. And then we summarize this across 5 to 10 ideas. And then we take those definitions that were reported for this 5 to 10 ideas, and we actually attempt to replicate that across across our data. And any data partner can get involved, can participate and contribute, or at the minimum we can replicate this across the data sources we have in Johnson & Johnson and J&J. But we used publicly available atlas. We reproduce these phenotype definitions collaboratively with people. So those people who want to learn how to use atlas can join the calls and see things happening in practice. And then also, like, the people who can do this will be people who know how to, like, we can divide and conquer. But the idea is to do this in a manner that others can join and see and learn in terms of like using tools. And then we would run these definitions across the data partners, the data sources we have. We can then use Cohort Diagnostics to report on, well, there are 5 different definitions for the uveitis. Once you implement them in data sources, this is how different they are in terms of the kind of people, the characteristics of people these different phenotypes yield, and then the different type maybe of different numbers of estimates of incidence rate that these different definition lead when you calculate something like the incidence of uveitis across the data sources. So we kind of say not only that there are these definitions, they also lead to different, well, we're going to assess how different they result in terms of patients' characteristics, and then how much of difference they affect the incidence of an event in a data source. Those two are proxies of like how much this would affect the results of a study. And we're just using characteristics of patients and maybe the rate of the event. And then basically those will be the 2 main outcomes. We will then summarize those, and we will also summarize how did the studies report on the phenotype. So we have to think more of like how would that look like, but we basically will have an understanding of how in a manuscript the phenotype definitions are communicated. And as a result of that work, we can also work on a recommendation of a template that we would say, if you run an observational study, maybe using a CDM, this is how we would recommend a standardized template of reporting your phenotype in a way that allows reproducibility, full transparency, and really provide all the specification of a phenotype so another study can reproduce it, or a reader can fully understand how things were defined, and also how would you report in the evaluation you did, whether you used tools like Phenotype, Phevaluator, or used something like Cohort Diagnostics, and so forth. So by the end of this, we will have a nice summary of what are the definition used for 5 to 10 conditions. We will have replicated those in the literature, and we can contribute that to the phenotype library. We would have, in practice, replicated definitions existing in the literature. So we would have by nature done kind of a atlas in practice tutorial for those who want to know how to use a tool or how you would replicate something if you have a CDM. And we would also have created or developed a template that we would share with the community. Once you run an observational data in a CDM, this is how you can report on the definition you use in a standardized manner. So people would take that text and reuse it across the studies. Once they want to publish something using any study will use a phenotype by definition, and then we can recommend that template, which will be helpful for the community. We would also go through, by the nature of summarizing the different cohort characteristics that that these different phenotypes yield, we will by nature have gone through cohort diagnostics, which will also be an opportunity to do like a training of how you use, what is the data you reported in cohort diagnostics, and how can you explore that data, and what can you get out of this data, and how you can summarize it. And that's a question whether we can be able to run phi-evaluated, but in theory we can also run phi-evaluated on all these definitions and report their estimated operating characteristics using phi-evaluated, which again would provide insights on the operational characteristics of those phenotypes that exist in the literature, and also an opportunity of how do you actually use phi-evaluated in practice again. So we're thinking that could hit multiple educational goals, which is part of Phenotype February for the community, would demonstrate how we can use the tools, but instead of coming up with phenotype from basically our different methods, we are just really using the literature as our universe of existing phenotypes, replicating those, and then assess the inconsistency across those, both on the practices and on the resulted phenotypes for specific conditions. Oops, sorry, I talked a lot. I hope that provide a high level. The document here kind of go into steps of how we could do this, but we have to elaborate on how we can collaboratively actually do this by maybe providing like a task list and assigning people, and people can contribute and so forth. But first, Jamie, Gautam, Anna, Asya, anything you guys want to add?
Yeah, that's a very great, extensive summary, and you talked a lot about the things we want to cover, and that definitely hits multiple goals. I wanted to reiterate on the sort of target audience for this, so that the nice part is that it also, I felt, touches multiple audiences. So if you don't know about a tool or approach and you want to learn, that would be a place you can come in and learn. If you want to learn about best practices and what people do, that also would be the place. If you have expertise and you want to contribute and be part of, the usual carrot of publication, that also would be the target audience. And if you want to share your perspective, that would be as well, because you can, contribute to the corresponding parts. And also another audience would be if you want to build phenotype for your study and you need one, that would be the target audience as well. You can come propose your phenotype and get it actually done and be more involved in the whole process, and again learn more. Right? Did I capture that well? That we have all of this people who might be interested.
Yeah.
I think what this document needs, in my opinion, is it currently seems very hard for anybody seeing this for the first time to actually know where or how they would contribute. There's indeed a great big long list of linear tasks to do to get to the end point, but how some, just random person in the community would participate and where is unclear in this document. So I think that we would need to share this document or something like it, hopefully a simplified and shorter version of it, but also have some extremely clear and direct ways for a person to get involved, because currently there are like a million places anyone could get involved, and when we put that out to 200 people on the call or 100 people on the call next time, it will be kind of chaos in terms of how people will think they can fit into this.
Yeah, so absolutely. So at the end of, if we agree on the principle that this is what we want to do after hearing from everybody and get everybody's feedback, we will do similar to what Gautam and I did last year, basically create a calendar with every week, and split all of this into particular tasks that need to happen at particular days, and then and the fashion that they're happening. For example, literature review is not something we need to do like on a call or collaborative. This is a task that can be distributed and people can do it on their own time and report back. We're also gonna have kind of like how do you report back? Where do you put the information or the data that you produce? So we're gonna create templates and stuff like that. But the idea is this will transform into a calendar, and then every day on the calendar has a specific thing that need to be delivered or completed, and we will specify that so people can literally say, okay, the way I'll contribute, I will take responsibility for this task, and that will explain what are your inputs and what your output for for those tasks. So it'll be way more like there will be a calendar. There also we need to cut it down into this is how you can contribute, and put all the bullet points of contribution and then link that to a calendar time so people know what amount of their work they can commit and at what time.
Gotcha. But so I guess the for Tuesday, the idea is to get just to in 1 hour slot on the community call, try to get some degree of agreement that in principle, this will be the Phenotype February activity.
Yes.
Do you think it's reasonable? Yes. Do you think it's reasonable by on Tuesday to have a calendar set up with ways for people to sign up? I mean, it kind of has to be now, considering we're at the exact end of January.
Yeah, so that's what we did last time. We kind of used the Friday call to agree on the principle, and then right after that, we go into the details with like a calendar that at least detailed the first 2 weeks very well, so people can sign up. But yes, the point is, after we agree today, we will detail this into a Excel sheet with tasks and calendar time.
Tech, you have your hand raised. Go ahead.
Yes, so this is great goal, and I'm a big fan of Phenotype Group and Phenotype Februaries. I didn't have time to participate in some of the previous one as much as I might have now. I feel like maybe this document doesn't go far enough, and it seems to me maybe it's kind of predictable. We all know that the practice is kind of lacking, and I don't know. I would also challenge us to consider some edge cases. One thing, it would be nice to have a phenotype for preventive care, and something which goes something other than just a disease.
Yeah.
Maybe a clinical decision support idea, or someone adherent to preventive care, and compare across countries who is getting what. The other one is we should pick a phenotype which perfectly models something, and it shows how 1 or 2 institutions modeled something well in a CDM, and if others would follow it the same way, we could have high quality studies. So I can think of maybe people who had tissue sample sequencing or exome sequencing and had their cancer outcome versus those who didn't have that. Something where, or somebody who logs into their personal health record often and their long-term outcomes are better, as opposed to those who have no events of ever reviewing their personal health record. And if we find an institution which is able to add events like patient login to personal health record. So really go beyond the typical and the usual, and are we going to compare two phenotypes in claims data across maybe countries? We should go after some really interesting and maybe even have some phenotypes which will completely fail, like for example, who goes to their eye doctor and we don't have, or dental record, and showing that we cannot show certain gaps in the record, and really highlight, rather than to be a perfect story about how things are great, we should have also a story how things are not great and how we plan to fill in that gap. And the other point is, maybe it's more for the OKR, but if we can do anything with the AI and large language model with the review of phenotypes, that would be another bonus.
Yeah.
But can I just summarize what you said, just so that we can take them into like an action type items. So the first point is, we can, if we make sure that we include some ideas that are not like specific conditions, rather some maybe health, what do I want to call it? Like maybe some health practices ideas, such as preventive care. Is that correct? And discuss and use that as one of the phenotypes and go after them. So we, like, one of our examples should be something that is not an exact procedure or an exact condition, but rather a construct that is heavily used in health research, such as an idea that we can label preventive care. So a more vague idea that doesn't necessarily present a clinical phenomena, but rather a health practice construct.
Yeah, we can. Yeah, you can also like high utilizer of healthcare. That's a construct which is not a phenotype for. It's not driven by, yes, I have this such and such condition, but really non-traditional types of things you could do with the CDM data.
Yeah, understood. Yeah, so if we include some idea that is a construct rather than a clinical clear condition or procedure, and see what's been done in the literature and see what we can do in our CDM, we can learn from that experience for people who do these kind of health utilization kind of studies. And at the same time, we can understand how the data included in the CDM can affect how well we can do these things. And maybe we can conclude that there are certain things that you cannot do if you only have claims, or you will do very poorly. Does that summarize it?
Yeah, and that goes after that, the unusual case and challenging it, go to the edge of the what we could do or what we cannot do.
That's it's a very nice idea. I really like it. That made me think of a very adjacent topic. For example, people, and I hear this notion from time to time in other places as well, is that community and researchers do not necessarily know what limitations are and what they cannot do. And especially those who are just coming to OHDSI. So like they don't know whether they can do this or that phenotype. And usually, we do not answer this question until we do feasibility analysis. But it seems that we've already accumulated some knowledge on the limitations right? For example, limitations to our current phenotyping approaches. You cannot blindly use ATC, is one of the examples that popped up. Or we cannot reliably estimate or phenotype alcoholism or something like that, or social determinants of health, So like the areas where we already as a community learned that there are some common limitations of the data or approaches. Do you think it would be, and that's a question, that's an actual question, I'm not pushing on it. Do you think it would be useful to, in some sort of way, also share that knowledge? And I'm sure you guys also accumulated these types of insights over your work.
Mhm.
That was a question.
No, and I no, we don't have this anywhere. Like it's all like there are certain basic some ideas about you can do this and you cannot do this that we don't actually document anywhere. Like it's just in people's head.
Yeah. That's
Yeah.
why I was like, do we want to make it explicit? So that there's, I don't want to say knowledge base, but like pretty much share what people know about what they can and cannot do, and that sort of refers to also partially Wojtek's comment.
Yeah, but I mean, what we have is good. So the 80% could be whatever the traditional proposal was. So I'm just not really, I don't want to disrupt the whole really great idea and great positive power to do just the usual phenotype February. My point was just if we can, have devote new cases to some of the challenges, that might be inspiring.
I think that Wojtek, I like what you're saying.
Idea.
So I was just going to say, Wojtek, I like the idea of what you're saying in that putting some less traditional phenotypes in there that are more challenging we will learn a lot from doing that. But I think that the general state, like phenotyping abilities of the entire community is not such that that is something everybody can do. So I think that your 80%, 20% like split between traditional condition-based phenotypes is probably good for most people, but then there should be some of these more more complex medical concepts like service utilization patterns or etc.
Actually, could we, just before we move to another idea, could we actually state what would that construct would be and just add it to the list of the ideas that part of those 5 to 10 and take that to action? I think this will take that point and then
was your example of like high health services utilization, was that just an example off the top of your head, or is that actually a clinical concept you think that could be, we could actually try to do that one, or is that just
can you define a construct that you think is not traditional and problematic?
Well, it doesn't have to be problematic. Well, one is problematic: dental care, right? People who have preventive dental care have fewer dental problems long term. That's one example where it's problematic because dental data is not there. The other one, ophthalmology, like, do you wear glasses? That's a risk factor for a number of things. We don't know if somebody is wearing glasses or not because it's prescribed by optometrists and it's not covered by traditional health plan. Or how often do you go to your ophthalmologist? We don't know that very well from some of the data sources we have. The high utilization was just an example. I quickly came up with something that has nothing to do with diseases, right? It only has to do with pattern of seeing healthcare facilities. So it was off the top of my head, and I would have to think about it more. It's all spur of the moment thinking rather than, I have been waiting like 3 months until I can mention it in the February timeframe. So it's more just trying to go to something non-traditional.
I think one that's like a common problem across all of the community is severe versus mild forms of a condition, because a lot of at least claims data don't include any of that information. So specifying that. And I'll shut up now because it looks like Chris has had his hand up for a long time.
I just wanted to complete. So I think we should tackle this in many different ways. I like the idea of non-standard. I really liked how you ended, Jimmy. The severity challenge is something that's probably something we can explore, and that could fit into the non-standard idea that Wojtek proposed. So we can extrapolate that further. Chris, go ahead. Christopher, go ahead.
Yeah, thanks so much. I really like this idea. And the conversation kind of brought to mind an issue, which is I think the Phenotype February is a little challenging in that the community is very heterogeneous in terms of their familiarity with OHDSI, the open source tools, and their abilities with data science in general. So I wonder whether it'd be nice if we had a list of kind of interaction points for the community. Okay, you can do this task this day on the calendar that we were talking about, whether we could tag these tasks as kind of like beginner, intermediate, advanced, or some way of stratifying based on familiarity and skill set. Because the idea that just came up, like that's really interesting, and I think seasoned people that are experienced with phenotype development will be very interested in that, but definitely not something for the new person, first Phenotype February ever, to try to sink their teeth into. So I wonder if there's a way that we could maybe tag those ideas.
Yeah. No, that's a great idea. Yeah.
Okay.
We can tag of like let me think. I was even thinking when people sign up, I was thinking you can sign up as in two capacity. You can sign up as an observer. So you wanna make sure that you are attacked on the call. If there's calls, you are so you get involved to observe as a learner. And you can, I was thinking of like two levels of like observer and like actual contributor on each task. Like you can pick to be involved in each task in one of these two capacity. But I think we can also add like kind of, if you're going to be a contributor, this is the level of like understand level of like knowledge you have to have, or something like that. But sometimes, Chris, we need people to contribute who have no idea, just like people who actually don't know much about like data sciences, but have a very good experience in the topic of the phenotype. So example, like a health utilization researcher would be super great contributor if we're gonna look at what have done in the literature in those, even though even that person maybe have no idea of like data sciences, but at least can understand those studies that and have a good understanding of what are those studies who look at this and provide that information.
Yeah, I totally agree. That makes sense. I'm more speaking from just personal experience last year in Phenotype February. We were very enthusiastic. We just didn't have the skill set and technological capabilities to like advance our phenotype as far as we wanted to. And I didn't fully understand that at the outset of Phenotype February.
Yep. Point taken. Yep. Other feedback, ideas, things that you guys or people thought we should cover in a Phenotype February, dimensions, anything. Somebody might not like the idea at all and say, let's just couldn't like finish the thing that we started. Like any thoughts? Could be anything.
Also, is anybody on the call or anybody that you know would like to join as the core group to lead the effort?
Don't be shy.
I'm just going to put it out there in advance. I'm going to volunteer to work on the evaluation component of whatever phenotypes get created. I'd like to work on that with Joel, who is our measurement error, like he who creates the measurement errors, I kind of want to do something with them to help use those measurement errors to evaluate the degree to which those errors would actually change the, incidence of the particular phenotypes. So I don't know if that adheres to that. Doesn't answer Gautham's question of like who wants to participate in the subgroups, but that's the focus that I would like to take on it. And I think that we'll see that, there are lots of contributors, like Christopher was saying that might not have the capacity to run something like Phevaluator. So I think that is a opportunity for those with that ability to focus on that particular piece, for example. And I'm sure that of all of these, like several dozen steps that are in this document, there are going to be lots of places where some people with more experience in the space are going to have to take the leads on it.
Yeah. Is Juan on the call, Gautam? He's not, yeah?
No, it's not. Yeah, he had sent me a message earlier saying that he's not getting notifications. So I did add all the emails of him that I know of to the call meeting.
Okay, because the question might be like for those phenotypes in the literature that are probabilistic based and not rule based, because they should show up as well. And then how can we also like replicate those using Aphrodite, and if he would be willing to lead that, because none of us have the skills to lead that. Joel, would Phevaluator be able to actually to estimate a PPV and sensitivity for a probabilistic model? That won't work because that would be the gold standard itself.
Yeah, the probabilistic gives you the probability of having it, but the problem that we have is that we test probabilistic. I think some of the Aphrodite stuff, or I think the way Aphrodite works, it bases it on codes. So for diabetes, it looks for people with diabetes codes and produces a probability that person has diabetes. I'm not sure how far it goes outside of people without codes.
Okay, so do we all agree that we are doing Phenotype February? So the next task would be a communication. I'll work with Aza and the group here to send out materials to Craig today. We'll also then break down and see what other additional tasks need to be done in terms of breaking down the whole month into sections, identifying, creating a sign-up sheets where people can say, this is what they want to do. They want to be an observer. They want to be a contributor. If they want to contribute, we'll think about Christopher's feedback about how do they say what they want to contribute so that we can link them to the opportunities that they can contribute. I think it's going to be exciting. Another year. Okay, can we switch gears to OKR? Is there anything else about Phenotype February?
Can I just add one thing, because we do want to throw a list on Tuesday call so we can vote on the phenotypes to focus on. Christopher, if we actually put, what was your phenotype?
Yeah.
So mine?
Yeah.
Dermatomyosite. I'll type it in.
I'm just thinking for one, like it was a Phenotype February phenotype from last year, and you're getting ready to finalize the phenotype we ended up with and put it in a paper. If we have, part of the process when you guys build it, we did look at what's there in the literature. But if we add this to this exercise, it could provide data for your paper to say like, we evaluated all the other ones that exist in the literature, and like it can add up to that paper, just that component of it. Because then you will have a full replication of whatever existed. I know like we already incorporated those, but then you have like a structured review of those and how did they differ from what you came up with as your recommended phenotype.
Yeah, that sounds great. I just felt bad kind of having our phenotype be in consecutive years and potentially blocking out other possibilities. So
yeah, we'll just throw them. I mean, people will vote, so we will.
okay.
But I'm thinking of low hanging fruits that also can add to manuscripts that are already in the making.
Yeah, so as I think just listening to your proposal today, I think one of the requirements of the phenotype that will be selected for Phenotype February is that it should be studied quite frequently in real world observational data. And that is a requirement because if you're looking for how people have phenotyped it and looking for variations of those phenotypes and try to replicate those, you need to have multiple variations. And variations will only exist for frequently studied clinical ideas. Dermatomyositis would not be one of those, I think, because I think what Christopher is leading is is the first of its kind.
Yeah.
So that might be the challenge there. The colon cancer that Wojciech proposed maybe something that's commonly studied. And so it may have 15 different variants of phenotype algorithms out there.
Yeah, I don't know whether this fits in, but Alan Wu at Northwestern has started up looking at Parkinson's disease again. And I was working with him last week and working with the group last week, and it's an interest. What I learned from that is that a lot of neurologists aren't diagnosing somebody with Parkinson's disease. There could be a long lead period. The person is under observation for a long time before they actually will declare it as being Parkinson's disease. So it's
yeah,
that might be something that's interesting too, how to manage that.
Indexed misspecification.
Yeah, I also think, what we could also
That's
learn.
part of it, yeah.
Yeah, what we can learn very quickly, which I think is back to the point that was raised about like, what is the limitation of the data itself? A lot of the phenotypes that exist in the literature actually do require certain granular data that if we can conclude that, the three big observational data sources, at least in the US, doesn't have 90% of the granular data required for these big phenotypes, that's another finding. Back to the point of like, what is actually just not feasible, but this is what's used in the literature, but it's actually not feasible to be replicated across like the biggest observational data available for observational studies.
I mean, an example of that is, heart failure. There's a ton of heart failure. There's at least two different etiologies for it that are very different. They just happen to call them both heart failure. But the subject's health comorbid conditions are very different. So, and it's very difficult to separate them out in observational data.
Okay. So we'll summarize this based on that. We'll simplify it into certain tasks, and hopefully we'll get people to sign up. And Gautam, we will utilize the Fridays for February for conducting collaborative tasks like building cohorts or looking. Yeah.
Yeah, so I think Friday mornings, do you anticipate just using, so we have 2 Friday meetings for the work group in February. Do you want to make it 4 for next month, Aza, or do you want to just keep it still 2?
Let's see how we're gonna break the tasks and see what of those should be like is useful to them collaboratively on a call. And maybe we leave this open, like we just assign that this is a collaborative call task kind of thing. And then depending on who signed up for it, we put the times, because maybe somebody signed up that doesn't, the lead doesn't, like that Friday time is not good for them. So let's leave it open and decide on the timing depending on the leads. If we ended up have the same leads, then Friday would be the right time, but we'll see. Hopefully we'll have other people too.
Okay. I'll bring the last set of slides that has the OKRs. So this was our last year's OKRs. We have this one will continue to stay because that's one of the core functions of this work group, promote the usage of the OHDSI Phenotype Library. And that includes, I think we'll have a paper on the Phenotype Library that's in, we've talked about before, that's in advanced stage. Juan is working on it right now. It's out there in the public, and I've received some feedback. So we'll put that on. We will continue to promote the usage of the OHDSI Phenotype Library in studies. The how often was one such effort, but we'll have more granular at a study level. The submission process to the library is clunky and very difficult right now. Juan has an idea. Juan and I have worked on an idea that we want to have a submission process that is much more simpler. And I think that will put that as an objective. So I think the usage and the OHDSI Phenotype Library will be one, and we'll have few key results as part of it. The next one is the Phenotype February itself, so we can break down some of the discussions that we had in Phenotype February as key results, community participation, community education, and so on. That we'll put there. Well, we need a key result around probabilistic. We're trying to push that idea a little bit further. We are still struggling with that from a probabilistic. We are heavily weighted towards rule-based phenotyping. Nothing wrong with it. It's just something that we need to do. We'll have some key results on scientific papers. Those are just foundational key results, and that's a lot by itself. Anything else that anybody can think of that we should try to capture?
We just mentioned the AI develop.
The AI, yeah. So we want to use Gen AI, large language model, to help with phenotype development and evaluation. So we can work with the with another work group that Martijn is leading on this.
So Gautam, should we just focus on, instead of having all these things, maybe we just focus on 3 main deliverables?
Yep.
One would be has to do with the objective 2. My other meeting started. Okay, one that has to do with the objective 2, but maybe focus, make it more specific by, saying like the training and the phenotype, like the things that we could achieve from Phenotype February, put it as OKRs for objective 2, and maybe objective 1 not touch it this year. Other than the paper itself, you can put it back under the Phenotype Library for the development and evaluation. And maybe we say something about like innovation or development, which would include AI, and like specify this into something concrete that we can help with Martijn and Anna work to push forward.
Okay. Anna, any thoughts? Because you just called out.
I need to, I would need to think what could be put as an objective. A broader objective is to support whatever people are doing. So just support community in their phenotype related activities. So that would sort of be an umbrella term for all sorts of involvement, including helping others in their work without binding to specific projects. Because, like, if you put help Martine or get involved with Martine, then you create this external dependency, and God knows how it's going to play out throughout the year. So that was my consideration. But of course, we can come up with something. If large language models, if ease of a specific interest, we can come up with something that covers this area.
Okay. All right, guys, we are on time. I'm going to stop the recording. All right, I'm really looking